Hi guys, now today I'm going to show you a technique that we used to make a whole bunch of front teeth which looked really massive, how we made them smaller and much less dominant. So let's have a look at the patient and let's see what the issue actually is. So here we can see that the front teeth are just like really kind of massive, right? And this here, this is a temporary tooth which another dentist has done because the actual underlying tooth is just really broken down quite recently here. And this tooth here, even though it's actually much wider than it needs to be, it's a crown which another dentist has done. And I'll explain why they've done it like this and how we actually change the treatment so that we wouldn't get a crown looking like this afterwards. But if we look at it from the side, you can see that not only are they big, but they're like coming forward. They're almost sitting in front of the patient's lower lip, right? And it's just making the front teeth way too dominant. This is actually, quite a small lady, and it's a small lady with big teeth. It's not not a great combination. So we need to understand why the teeth are in the position that they're in, and how can we redesign this smile, doing the least amount of work possible, so that she can have a great looking smile that suits her whole face. So to explain this in better detail, I need to actually show you why the teeth are like this, and I'm gonna show you a photo which has got a close-up of teeth. So if you're if you're grossed out by this stuff, you maybe shouldn't be watching this channel. Anyway, if we check this photo out here, you can see that her teeth are actually slightly apart at the back, but at the front they look pretty close together, right? So when her teeth come together at the back, what's going to happen is these front teeth are going to come up really close to the gum behind the teeth at the front. All right, and let's jump into a different photo and I'll show you this kind of close up. Okay, so on this photo, these are the backs of her top teeth, and this is that kind of temporary whatever it is that other dentist has done. And you can see that this crown has got a metal inside, this one's got a metal inside here. But what I want to draw your attention to, and this is really subtle, but here, here in this kind of bit like that, that's a bit like that, and that's a bit like that. Her bottom teeth are actually contacting just where I've drawn this in, here, here, and here. And what that's doing is it's stripping the gum away from the back of the tooth. But more than that, it's actually putting a gentle forward pressure on the teeth. Let me explain how this works. So if we imagine, and let's just go to kind of black and white color here. So if we imagine these are someone's lower teeth, something like that. And normally what we want is, actually I'll draw it in her case, her top teeth, if they were in a good kind of position, would be something like that. And we would get a little bit of contact here maybe. Now, what's happened is her lower teeth have moved into a less favorable position, let's say. So let's choose a different color so it's nice and clear. And her bottom front teeth have moved up. Remember, they're contacting up here somewhere, so they've moved up like that, and they've probably moved forward as well a little bit. But this contact point has moved from here to here. And what will happen is the tooth is going to rotate around this point up here when we put a force like that on the tooth. And the tooth is going to change its position to be something like that, right? So the edge of this tooth has moved massively more than this contact distance here, and the tooth is more forward, it's more dominant, it's more what we call proclined. And when all of the teeth kind of just move forward like that, you get spaces between the teeth, and you can see those spaces here. And you can see those spaces just developing here. So when these crowns were done, I doubt the dentist would have put a space in between them. Even though he's made them too wide, he or she probably wouldn't have put a space in them. So this is something that's developed afterwards. And speaking to the patient, she told me exactly the same thing. When the crowns were done, they looked okay, but now they don't look good. So now we know what the actual cause of the problem is. We now know how to address it. So even though the patient came in to talk about her front teeth, to correct them properly and to stop these problems reoccurring later in life, what we need to do is actually level out the bottom teeth. So when I say level out, I mean the level of these back teeth is at one level and the level of the front teeth is at a different level. We need to make that more harmonious. We need to just make sure everything is on the right level. Once we do this, we're going to get a little bit of space behind the top teeth when she bites together, and that is going to let us bring the top teeth back and redo the crowns, put veneers or whatever we need to do at the top. So this tooth is a tooth that had to go. We needed to remove that at some point. So the first thing we did was put braces on the bottom teeth to level them out and remove that front tooth. It left us open with an option. We can either replace it with an implant or a bridge. The decision is totally my patient's in the end. So here's a photo taken a couple of months into treatment, and there's a couple of things which have changed. Number one, this front tooth has been removed, and this is a removable temporary tooth just while we're sorting all the other things out. So we've got rid of this, we've got rid of this nasty tooth which we just couldn't save. There was nothing left of the tooth, and we've also leveled out the front teeth. Now can you see the level of the front teeth compared to the back teeth is much more even than it was in the photo before. And this has probably taken about 3 to 6 months to get to this stage, and there's still a bit more to do because you can see there's a gap in between the middle of the teeth here, and the teeth have actually tipped forward a little bit, which is something that happens, so we need to just tip them back just using the braces. So we carry on with the braces for a little bit longer, and then we need to just bring the front teeth in. But instead of using braces, I did a bit of an experiment, and I used a kind of an elastic band, and you can see that I've got this elastic band connecting the front kind of 6 teeth here, and all that's doing is just sucking everything in so that we can get the teeth in a better position. Once the teeth are in a better position, we can change the crowns, we can put bridges, we can do implants, veneers, everything we need to do, and it's going to fit. The teeth aren't going to look dominant, and it's just going to look a lot nicer. So that's all we did for about 3 months, or even less than that. Once we had space behind the top front teeth, and we could bring the top ones back in, and what we decided to do was to replace that tooth with a porcelain bridge. So that's just the process of doing it. And whenever we do a porcelain bridge, we're going to first do it all in temporary material. So this isn't her final result. This is just what we call a trial smile, which lets our patients visualize what the end result is going to be like. The advantage is we can change this as many times as we want. We can, if the patient says they're too long, we can make them shorter. If they're too square, we can make them more curvy. We can do literally anything in the trial smile stage, and then when it comes to getting the final veneers, we know we're going to get exactly what we want, because we take a record of these temporary ones, we tell the lab to copy them, and they copy it perfectly. So a few weeks later, we fitted the final teeth, and this is what it looks like on the day of fitting. That's why there's a little tiny bit of blood there, but you can see the tooth height and width is really good. It's harmonious. What I mean by that is the teeth reduce by an even proportion as we get further back. The level of the gum on each tooth is symmetrical, and here this is actually a bridge, by the way. It's not an implant. So this tooth, and this tooth are all connected to each other and all just slot on as one unit, and it's really difficult to get the gum level symmetrical on two teeth, on the two front teeth, when one tooth is there and the other tooth is missing. But the lab did a fantastic job, and they've managed to do this really nicely. The bottom edge of the teeth are following the lip nicely, and the patient's like really happy with this result. When you compare it to where she came from, it's a completely massive life-changing difference that we've made for her here. Great, so if you enjoyed this video, please remember to give it a thumbs up, give it a like, share it with your friends if you want to. This treatment was carried out at Perfect Smile Studios in Hertford. If you feel that you want us to have a look, you can give us a shout and we can discuss options over the phone and stuff like that. So, hope you found it useful. I'll see you later. Take care.